Hi, my name is Maurath, and I'm going to talk about acute methotrexate-induced crystal nephropathy. Definition: Methotrexate is a type of antimetabolic and antifolate that is used to treat many types of cancer. Acute renal failure occurs in approximately 2% of patients who receive high-dose methotrexate for the treatment of a hematologic cancer. Application in medicine: Methotrexate can cause life-threatening side effects. Methotrexate is taken to treat cancer or certain other conditions that are very serious and cannot be treated with other medications.
Low-dose methotrexate is extremely effective for treating rheumatoid arthritis and other conditions such as psoriasis. It remains the gold standard treatment within the professional healthcare community and has helped many patients feel better, control their disease, and achieve remission. Taken once a week, methotrexate works by reducing pain and swelling and can slow joint damage and disease progression over time. There is also evidence that methotrexate may reduce the burden of heart disease in rheumatoid arthritis. There are two ways to take methotrexate, either as a tablet or an injection. Tablets enter the bloodstream through the digestive system. However, injectable methotrexate avoids the stomach and intestines, which may reduce side effects like nausea and diarrhea in some patients. You might be aware that methotrexate is also used in some cancer treatments. It's the same drug, but the dosage levels used are very different. Most people are greatly helped by methotrexate and cope with few, if any, problems. But like all drugs, methotrexate can cause side effects, and your doctor or nurse will closely monitor you for these. One concern some patients have when prescribed methotrexate is hair thinning. Hair thinning is a possibility, but it's usually slight. Another common concern is feelings of sickness, especially when taking tablets. Fortunately, there are steps you can take to help minimize this. Studies show that taking a folic acid supplement reduces side effects by up to 79%, and changing from tablets to injectable methotrexate is also proven to reduce stomach problems whilst increasing the effectiveness of the drug. As to methotrexate and alcohol, a recent study has shown moderate alcohol consumption of less than 14 units a week shouldn't have an adverse effect on your liver. That means you can continue to enjoy the odd drink while on methotrexate. Just ensure your doctor continues to monitor your bloods regularly. It may take up to 12 weeks after reaching the best dose for your condition before you notice any benefits, so persistence is key. Remember, at any stage, you and your doctor can agree to adjust or swap treatments. A healthcare professional should always be your first port of call for information. There are also advice helplines, websites, and patient groups to help answer any questions you may have.
Pros and cons. Pros: More than half of people taking it see a 50% improvement in the course of their disease. It is an effective treatment and most people tolerate it. Cons: Methotrexate can make you more likely to get infection or may worsen any current infections. The use of high-dose methotrexate as a cancer treatment carries a risk of significant nephrotoxicity. Issues applied in Ecuador: In the Ministry of Public Health, it is recommended to use methotrexate as a first-line drug for the treatment of rheumatoid arthritis. The dose should be optimized with rapid increases up to 25 mg per week and associated with the intake of folic acid.
Hey, this is Medicos Perfectionalis. Let's talk about urine crystals. So, urine crystals are urine sediments that have specific shapes under microscopy. So, if you know the shape, you can know what type of stone it is, and it will be of great help on your board exam because it will describe to you like the stone. Like, for example, hexagonal shaped stone. It's like cystine. Rhomboid, it's uric acid, etc. So, that's the topic of today's video. So these are the most high yield crystals for your exam and for life. So first we have the envelope shaped crystals. These are the calcium oxalate. The mnemonic, or the way that I remember it, that calcium oxalate stones are the most common type of stones. So the envelope is the most common shape that you see in your life. You receive and send mail all the time. So calcium oxalate, envelope. Let's go to cystine stones. They are hexagonal in shape. How do I remember it? Cis looks like 6. Okay, especially if you know French or Spanish, it's pretty close. Other, we have the struvite stone. Struvite stones are bad, like really bad. The shape is coffin, which is bad. Okay, the way I remember it, you can like say struvite as starve to death, and death is related to the coffin, of course. Last, we have uric acid. They are rhomboid in shape. The way I remember, uric acid, sometimes like gout comes into mind. And in gout, like the definitive diagnosis is to get joint aspirate, okay, to see these crystals, okay, and if you see them, they are negative birefringent and they are elongated. So here, this is the most elongated shape, okay, in this stuff. So uric acid, rhomboid. So envelope, calcium oxalate. Hexagonal, cystine. Coffin shaped, struvite stones, the evil one. Rhomboid shaped, uric acid. I hope it's simple, because it is. Now it is. And please subscribe, give it a like. You can like us on Facebook, follow us on Twitter. You can support these videos on Patreon. I'll be grateful if you do that. But for now, enjoy the day.
In conclusion, acute renal failure occurs in approximately 2% of patients who receive high-dose methotrexate for the treatment of hematologic cancer. This case also shows that acute renal failure can occur even in the absence of toxic methotrexate levels in plasma 24 to 48 hours after infusion. For this reason, and because the concentration of creatinine in serum is a poor marker of renal injury severity, the doctors think that the prevalence of methotrexate-induced crystal nephropathy may be underestimated.
Hi, I'm Dr. Tom Palella, a rheumatologist with Rheumatic Disease Center Physicians. What can someone expect when they're started on methotrexate? They can expect to have a medication which they tolerate quite well, and over a period of time, they begin to notice an improvement in their stiffness, their pain, their fatigue. Their energy improves, the quality of life improves, their dependence on pain-relieving medications lessens, and they get back to a more active life. The medication has some side effects, most of which are mere nuisances and are easily managed by giving a vitamin called folic acid. The nuisance side effects include sores in the mouth, diarrhea, mild hair loss, abdominal pain, and sometimes nausea. There are, however, certain serious side effects that can occur as well. These include a severe form of asthma associated with fever or chronic progressive scarring of the lungs. Fortunately, these are quite rare, are easily recognized, and easily managed.
Thanks.